Everyone. So my study is the correlation of anxiety with visual field testing by standard automated perimetry in glaucoma patients, prospective study. So we know glaucoma is a chronic progressive optic neuropathy with causing irreversible retinal ganglion cell loss, optic nerve cupping, and characteristic visual field defects. It's the second leading cause of blindness worldwide. Early detection and continuous monitoring is essential to prevent permanent vision loss. Standard automated perimetry is a gold standard for the functional assessment in glaucoma. Measures visual field using light stimuli where the patient maintains fixation. A learning curve exists. Therefore, tests often repeated 2 to 3 times to establish a reliable baseline. Despite its value, the automated perimetry is often not patient-friendly due to the need of sustained attention and active participation. Built-in reliability indices include fixation losses, false positive, false negative. Anxiety can significantly affect test quality. It can improve or impair the performance, can increase variability and reduce reliability of the results, can influence the clinical decisions and glaucoma management. In some cases, increased anxiety may enhance the alertness, improving certain reliability indices. There is limited evidence, no substantial Indian data to it. So my study was to investigate the correlation between anxiety levels and visual field testing through reliability indices, including false positive, false negative, fixation losses, mean deviation, pattern standard deviation was also taken into consideration in patient with glaucoma. So here, there was a hospital-based study where 140 glaucoma patients from 30 to 70 years of age who are diagnosed of glaucoma on topical medications over a period of 6 months. Exclusion criteria included prior surgeries for glaucoma or any iridotomy or iridectomy was done, or a pre-existing anxiety disordered depression on medications. Patient received they received proper explanation before the testing, and all of them underwent the perimetry of HFA 30-2 C, the standard strategy, and included reliable fields also. Then the anxiety was assessed using questionnaire basically. So there was a state trait anxiety inventory. We have pre-test, intra-test, and post-test questionnaires was given, and the scores were calculated accordingly. Data analysis, descriptive statistics used for categorical frequency, percentage, and continuous variables were noted, and a Spearman correlation application was to evaluate between these the parameters in the HFA as well as the anxiety scores. So the results, age distribution is there. The major one is the Spearman correlation analysis. It revealed a significant negative correlation between the intra-test anxiety scores and the false positive rates. Then a discussion was that a total of 140 patients were given. The enrolled to the study. Mean age of the participants were 56 plus 10 years. Spearman correlation analysis revealed a significant negative correlation between the intra-test anxiety scores and the false positive rates. This indicates that the higher anxiety during the test was associated with the lower false positive rates. While doing the study, we were a bit amused by this also. It's not like that. When anxiety increases, the reliability should decrease. That's a norm. But here my initial study, this was against that. But when I researched, there were studies where they were correlating this higher anxiety to more alertness. So only that was significant enough. No other significant correlation was found. Conclusion is that anxiety during visual field testing shows a significant correlation. In my study, it was especially with the false positive result. This relationship suggests that anxiety influences the patient response behavior during the perimetry, and here increased anxiety may have shown as enhanced alertness, improving certain reliability indices. So the understanding these correlations help clinicians to interpret the visual field results more accurately. Finding highlights the need for strategies to enhance patient alertness is a limitation actually, because it's a very small study population was done. Study does not take the familiarity of the patient, that is how, like for what time the patient is doing. Is the patient first time he's doing or he's doing for the 5th time? So that was not taken into consideration. Study does not mention about the methods to improve these text reliability or how to reduce the anxiety. Other perimetric parameters were not taken into consideration. These were my references. Thank you.
So if anxiety is helping,
Apparently with my study.
yeah.
And there is other the references which I put. The third study, it showed that with anxiety, they had a negative correlation with anxiety to the false positive. But with the initial study, it was not like that, the references. So there is a disparity in the references which I found.
what is one thing you can do to reduce the anxiety of the patient if it's working in negative way? I mean, if the pills are unreliable, what can you do in your clinic?
uh, with increasing the number of visits, like not pressurizing the patient to do HFA, like in one day doing it 3 times, or like calling the patient multiple times, that can reduce the anxiety because they are familiar with what is happening. For the first time they're entering the HFA room, they don't know what to do. Obviously, the results can vary. So,
First time, usually they don't know what they're getting into. So the anxiety does not matter.
you can give a
Second, third
pamphlet
time,
also.
no, it's more than like, one thing is based on the glaucoma type, you can uh, reduce a period, increase the period of testing the
Yes,
HFA. You can also get an OCT done periodically. You can have OCT also to correlate with the HVF.
yes.
Okay, so if even the HVF is not reliable, you can always fall back on the OCT. And counseling, of course, helps.
Yes. Yes, sir. Yeah. Yes, sir.
Nice study, Roshni. But just to, if you go back to your MBBS days, this result is expected. Anxiety, when it is mild, it improves your efficiency.
Yes, sir.
Just for example, before your exam,
Right,
right?
sir.
You can cover a lot of topic. But if it is severe, then it affects your efficiency. So you can grade your anxiety level and then do a subgroup analysis.
Yes, sir.
And if you compare patients with severe anxiety versus mild anxiety, your severe anxiety group will definitely have a negative correlation, just like the third study.
Yes, sir. Yes, sir.
You know? So look into that. Look for some pharmacological references. In KD Tripathi, the book that I used to say, this was the first statement: mild anxiety improves your efficiency.
Oh,
But if it is severe, it reduces your efficiency.